Good afternoon, everyone. Post lunch, it's a bad time, I know. Right? But you know what? We need to charge each other's batteries. I charge yours, you charge mine. What do you say?
Yes.
Good to go?
Yes.
Alright. Okay, training, something which I think is being spoken about very, very often. In every meeting, the word training comes up. In every meeting, skill development comes up. And you know, frankly speaking, up to a point, it's alright. After some time, it becomes an irritant. I tell you why. Somewhere down the line, while we work and we get caught in the rut of working and delivering service to our end patients and customers, we somehow get sucked into that whirlpool. And we don't get time to, step out of that rat race and reflect. Reflect what we are doing, why we are doing, and how much we are doing. People come out of colleges, they come out of universities, they are thrown straight onto the floor. If you ask the administrators, if you ask the management, look, why are you doing something like this? I mean, you are setting the guy up for trauma. Now you will not see it on their face, but it will show over a period of time. You're going to ensure burnout in these individuals. Be it a clinician and be it the guy right at the bottom, that's the ground duty assistant. You are ensuring it. Whether he's an employee, whether he's an outsourced person, it doesn't matter. He is a human being. How are we treating them? How do we engage with them? Training, unfortunately, is looked at nowadays as another item on the list to be ticked. That's a very sad approach, frankly speaking. Training is a non-stop engagement with people. Whose people? Your people, my people, our people. Healthcare is one of the most noblest professions. I mean, we say nurses are in a very noble profession. I say everybody involved in healthcare is noble. It's a fantastic profession to be in. I've been across industries like you were mentioning earlier, but believe you me, the 5 years I've spent in healthcare, my God, my understanding of healthcare, the people, my empathy and sympathy goes out to them. Really. Yes, even I grew up when people used to say, doctors are like gods, doctors are like gods. I got to know one thing, they are like as human as I am, they have a heart, they do feel, they are trained in a particular manner. They have to be. I am trained in a particular manner. I respect them, I respect the nurses, I respect the GDA, I respect the security staff, all of them. What matters is the quality of training that goes into them. There's a little message out here. There is an increasing focus on improving healthcare in order to ensure higher quality, greater access, and better value for money. Everyone today is talking about, is it worth investing? Is it worth going to a particular hospital? I remember giving this example that when we build a house, and we spend our own money, nobody's sponsoring, it's our own money. Do we cringe about the quality of paint? Do we cringe about the cupboards we're going to put in our home? No. We will spend that extra amount because we want durability. Similarly, people don't mind spending as long as they get the worth for the amount they're spending. And nobody is going to cringe for good healthcare. In recent years, training programs have developed to teach healthcare professionals and students to improve services, the patients, and give them good experience at the hospital. Everything is about an experience. Everything is about managing their impression, their perspective. You manage their perspective, you manage the impression, I think you're going to be fine. So what are we talking about? We are talking a blend of education and training. Education is that whole system of human training within and outside the schoolhouse walls, which molds and develops people, and training thereon sustaining the entire process. Training goes beyond education. It's about sustaining. How do you sustain a clinician? Update his knowledge. How do you sustain a nurse? How do you sustain the security person? How do you sustain the front office people? How do you sustain all those individuals who are patient touch points? How do you bring about the moment of truth? And a good one at that. It all goes through initially the education that they go through in their own respective universities and schools, and thereon the institute they join through training. Skill-based, soft skills, doesn't matter. It's training nevertheless. So, in the short span, what I kind of wanted to do was focus on a couple of things which are important. Why training is important. Get a little familiar with the kind of training that goes on today in healthcare. Trends in training, training cycle, I just touch upon that. Current gaps in training, and training for administrative staff in healthcare. So, why training? Just look at the line in the middle, the need for training both functional and behavioral. It's not just the technical training that's required, it goes beyond that, because you are engaging with people. One of the major factors, and let me say the differentiator in healthcare services, whether it's clinical or whether it's your from the hospitality side, it's the service that you give them. Doctors, fantastic, hats off to them. But why is it that the patient goes out and says, I didn't like the hospital here, services were rotten, services were shitty. Why do they say that? If you're going to ask them, सब कुछ ठीक था, हाउसकीपिंग ने टाइम पे आके वो यहाँ फ्लास्क चेंज नहीं किया. But what happens? Poor doctor gets enveloped into it. What happens? The poor nurse gets enveloped into it. And there are many examples like that. Technology becomes obsolete. Technology, very good. You've got to keep updating it. But who runs technology? It's people again. If you don't update them, you don't train them, technology is of no use again. Who trains them? Who gets them sensitive to what the customer wants? I don't like this word customer, but we'll have to use it. Okay? I would say the patient. I would say another human being who wants a little help. How do we touch them? How do we reach out to them and touch their heart? What we call as the personal touch. Who gives it to them? People like you and me. Does it come from our education? Yes, education does have a bearing, but ultimately, what kind of training we go through? What kind of timely training we go through? And the quality of time spent on that training. And that, correct me if I'm wrong, is a big question mark today. You ask anybody in any hospital, will you come and sit for a whole day, 8 hours, through a program? They'll look at you and they'll want to burn you right there. And they'll look at you and say, are you mad? Who's going to earn the mullah? You. That's an opinion, no problem. We'll live with it. But don't go on living with it to such a moment when you realize, oh God, I wish I'd invested time in training. So, training over the years, if you look at it, it's actually developed. Classroom training, vocational training, e-learning, and now it's all about collaborative training. Okay, I know for a fact, we were talking about it in the morning also, doing communication skills for doctors. We started that in Max Healthcare. In fact, I initiated that. And we went about doing it in a very simple manner, where we took care of their needs. And the first thing we did was to sit with them across the department, whether it's gynecology, oncology, your orthopedics, all of them came together and we asked them one question: where do you have a pain area when it comes to communication skills? And they came out with a little list. Then we compared that with what the customers were saying. And invariably the customers would say, I wish the doctor could be a little more specific. I wish the doctor could speak a little more. I wish the doctor wasn't looking at his watch all the time. You know, as granular as that. And when we showed that and we said, okay, now tell me, do you feel you need to sit in that training room? Yes, we won't make you go through the grind of 4 hours, but we can crunch it. They agreed. And then we took out a customized program which they all went through. We put a couple of tests in there to just show it to them that look how important it is. We're not devaluing what you already know. We only want to enhance it. And let's face it, guys, it's very simple. Your bread and butter comes from those patients who walk into your hospital. Whether you are a private player, whether you are a government player, it doesn't matter. Healthcare is required. Healthcare will always be there. I will require it at some point of time. God forbid you will require it at some point of time. But who would you rather be treated by? I rather have somebody who explains what the diagnosis is in layman language than confuse me even further. That's what training does. It brings down the level where you can interact with your patient. So, what is training today? An educational process, something which encourages thinking, conveying relevant and useful information to everybody. It's not just patients. Now, when I talk about training, I'm talking about both to the outside world as well as internally. So, doctors talking to nurses, big problem, big problem. Nurses talking to doctors, big problem. Be it the language barrier or whatever it may be. Then nurses talking to a GDA, another big problem. So everywhere you look, at every touch point, even amongst the internal customers, there is a problem. And what is that problem? One word, communication. The goal of training is to create an impact where, not between you and me as internal customers, but to the patient outside. Not to the patient, but to the patient's attendant who is actually going to spread the word. And focus is on creating specific action steps and thereby taking commitments. If you say, yes, we need training in a particular area, if you agree, then let's hold hands and go through it. Unfortunately, what happens is they'll say yes, but when the time comes to actually going through it, they'll say we don't have the time. No, that's sad, very sad. So what are some of the trends? Increasing focus on training to improve healthcare services, quality and greater access and better value of money, something that we spoke of earlier. In recent years, training programs have developed to teach health professionals, administrative staff, students to improve the quality of service delivery. It's all about quality. It's all about quality. Remember earlier I had spoken about being the differentiator? Differentiator, who makes that difference? A Fortis may buy Siemens or GE equipment, Max will buy the same, Paris will buy the same, Columbia Asia will buy the same. Equipment is the same. Great toys for the doctors to play with. Fantastic. But who's going to explain to the patient what that toy is going to do to them? There are people who are claustrophobic to go into an MRI machine. How will that radiologist, how will that doctor explain to the patient and bring down the fear of getting into an MRI machine? That's what we are talking about. We are not talking about technicalities. We are talking about simple, plain connectivity with that patient. Organizations are investing in training their staff at all levels. I remember when I started in 89, sir, training, never heard of. I still remember when I joined Godrej and Boyce, I was supposed to sell typewriters. And they had introduced the electronic typewriters in those days. I joined when I was a rookie, straight out of college. Alright, I go to my boss, he gives me a manual, he says, yellow beta, manual hai, oh. I said, ठीक है sir, training कब होगा? The way he looked at me and he would have thrown me out of the window. He said, training, what training? Machine वहाँ पड़ा हुआ है, जाओ बैठो पढ़ो और सीखो. आपको 3 दिन देता हूँ. In 3 days I want you ready to hit the field. This is what he told me. And I just graduated. The fright I got was only I know what I went through. But that was then. And today we say, have you been trained on this? Have you been trained on that? Front office, when we recruit them, the first question that's asked by HR, tell me how much of experience do you have in healthcare? And the guy says, sir, none, but I come from hospitality. How can that poor guy get training in healthcare? And nobody is giving it to them. But who's going to give it to them? If you want good quality people, are you willing to invest in them? Are you willing to give the time to them? Are you willing to say, if that's the quality I want 5 years from now, am I willing to spend 6 days, just 6 days, where they go through a good, organized, systematic training module? which covers both the technical aspect as well as the soft skill? That's the question I'm asking. Are you willing to invest? Training cycle evolved over a period of time. And let's look at the major blocks. We talk of training need analysis. Every organization nowadays gets into training need analysis. Let's do a training need analysis. It's done. What after that? What after that? Great activity. Looks nice. Board members are very happy. What next? Then forget development of training modules. Who develops the poor trainer? That's another problem. Then the training delivery. Does anybody understand what it means to have people deliver those modules in the way they're supposed to be? It has a great impact on learning. It has a very big impact on learning. If your trainer is very good technically, which he would be most of the time, but when it comes down to platform skills, Jesus Christ, God help the poor guy. Who's going to invest in that poor dude? That's the question to ask. And it's very easy for the HR guy or for the clinical head or for anybody else in the hospital to put a gun on the trainer and say, you've done a filthy job. Something to think about. As a fraternity, someone who is actually, let me say, traumatized by the fact that we don't get trained people. Then, feedback and evaluation. That's another story altogether. Now, if one was to follow this cycle seriously, not complicating it, our lives would be much better, I assure you. What are some of the gaps, if you were to look at them? People are focusing on training. People are focusing on the administrative section of the hospital. All those who are in day-to-day hospital operations, how well trained are they? Okay? How much time do they invest in training? I know for a fact, when I call some of these floor walkers or people who manage floors, they're kind of they are caretakers of the floor. They manage the operations of the floor. Most of them are doctors, of course, junior doctors. They don't turn up. And then when they go through the review, the entire list comes out as to where the problems are. And believe you me, correct me if I'm wrong, all the stalwarts are here, 90% of the problem is communication. Both ways. Communication coming from the top, and communication going upwards, and communication going horizontal. Major problem. They understand everything, but they can't speak or communicate or explain to save that situation. And then it snowballs into medical, legal, this and that, and for no good reason. Then, administrative staff needs several personal development, public relation, human behavior management, process trainings. Process, good. What about human process? What about engaging with people to understand why do they think the way they think? I've been told so many times, doctors have got a very big ego. Who doesn't have an ego? Tell me. And what is very, very clear is, what you sow is what you reap. If you are able to approach that doctor with humility, I don't think he's not going to respond to you. It's about respecting each other and their expertise. You respect theirs, they'll respect yours. If they don't, so be it, doesn't matter. Better the challenge. Try and develop that bridge. Try and bridge that gap. And that's what training is all about. But going further, it's not just about the doctor, it's about the doctor and the patient. It's about the nurse and the patient. If they are able to invest a little time to understand each other as a human being, understand each other and their work, their roles that they play, there will be a sea of change. That's one of the reasons why I always say, and I say this very, very clearly and repeatedly to HR, for God's sake, get your JDs, your job descriptions clear. As simple as possible. And sit down with the person, sit down with that staff member, no matter what the hierarchy is, and explain it to them. Keep 5 points, but keep it clean, keep it clear. Major problem. They don't know what they're supposed to do. Then, administrative staff specifically needs customer care training, management training, just I mean, it's kind of an overlap. But what we're trying to say is, it's great to have a clinician as a head of the hospital. In fact, they should be like that. It should be like that. However, it doesn't mean that a person who's not a doctor cannot be an effective administrator. It's all about fundamentals, it's all about your learning, it's all about what you're willing to do or invest in, which will make you a better human being first and then a better administrator. Because it's all about managing human beings. Period. There is a gap between the nurses and doctors, what I spoke to you. Poor nurses, can't blame them. They come from the south, there is a language barrier, we're still battling it. Believe it or not, I have started spoken English classes for the nurses. Very, very focused, script-based spoken English classes. And it's working. It takes time, but it's working. I started Hindi-speaking classes for some of the critical nurses, looking at the North Indian audience and North Indian patients. It's working. Slow, but it's working. Medical college now, something that we were talking about. I'm not an expert on this, but this is what I've gathered and when I've spoken to people that back in the West, if you are not very good at communicating and your communication skills are not very good, you're not passed, you don't go through your medical college. Because this is an integral part of your learning. Something that we were talking about in the morning, is it going to become that integral in India as well? Frankly speaking, if you want to stay in the race, whether you are in the urban area or the rural area, if you can't communicate in that respective language, you're bound to fail. There's no two ways about it. Then, healthcare industry does not come under the organized sector and the backup staff is not always trained. Now, this is another problem. We are getting organized slowly but steadily, but just like any other industry, whether it's IT, whether it's telecom, where or the BPO, for example, they have a bench of people who are ready to hop in when somebody is retrenched or somebody moves out. Healthcare doesn't have that. Healthcare doesn't have a bench of people, whether they are doctors, whether they are front office, whether they are nurses. They're there. Sometimes they're there, but who's going to pay for them? That's another big question again. So it's looking at your operations and the smooth delivery of services vis-a-vis, can I afford it? If you can't afford it, then you've got to work within the system and within the people, with your people that you have. Meaning to say, somehow, somewhere, someone has to say, all right, we stop operations, pull these people out, get them into a training room, get them equipped so that when somebody pops off, I can put this man who is ready to run. It's all about investing time. I'm not talking money yet. I'm talking investing time. I'll quickly run through this. Development activity will only work when the top management is committed. Very, very critical. Believe you me, I may stand on top of the roof and yell and shout about training. Nothing's going to happen if the big daddy sitting there is not convinced. Yep, I say it on their face. And whether they are willing to look at it as an investment or they're going to look at it as a cost. I'm fine with either of them. But you're going to see the result on the floor. You decide. There's a lack of qualified people in hospital HR. Now again, hospital being a new industry, an emerging industry, HR personnel come from different backgrounds. They are not fine-tuned to the requirements of a patient. Forget patient, that's a far-fetched thing. They are not fine-tuned to the poor nurses, or the doctors, or the paramedics. Who's going to train them? Who's going to invest in them? So your root is not being addressed, we're addressing the leaves. There is no culture building. Now culture doesn't mean people coming from overseas, no. When somebody comes from an IT sector into healthcare, somebody coming from an automobile industry into healthcare, marketing people specifically, they don't go through any kind of orientation. So what they do is they just piggyback on the knowledge and experience they have of that industry, try and kind of fine tune it and tweak it and kind of stitch it together and make them run. Some of them who are smart, it works. Most of them, it backfires. Badly. So, what's the scope of growth of healthcare in India? Something again which I pulled out. You can correct me if there's an update on this. In India, the annual additional requirement hospital beds have been estimated at 80,000 a year. The maximum growth within the healthcare facilities provided by private sectors, drivers of demand are middle income group in India, rapidly expanding proportion of population. Now, what we kept saying, people don't want to move to the rural areas, but for obvious reasons. New hospital projects coming across the country and several existing ones are expanding their services. Several corporate houses with professional managerial approach have ventured into the hospital industry. The good thing, and God bless those institutes, now I'm going to be what they call butter a little bit. Institutes like INLEAD, for example, when I heard that these guys are now going to get into healthcare, I said, fantastic. This is what is required. And we need more INLEADs coming up. Because if they don't come in, I'm not saying this because it's a fantastic place. I'm saying it, these are the institutes who are able to foresee and forecast what's going to happen to the healthcare industry if they don't step in, create that bench that people are looking for. So you guys are doing a great job. Congratulations. Then, of course, you have the bodies like NABH and JCI. Thank God for them also, because they are the ones who are now insisting that training be a very integral part of the hospital operations, and administrators are pulled up for it. Non-compliance being one of the major things as why are guys not trained with so many hours of training on a particular subject. So it's good. If we don't understand it in the sensible manner, then you need a policeman behind you. Can't help it. So, two types of operations. You have the generalist and the specialist. Both require training. Okay, each one in their own area. However, I won't go into the detailing, but you got to be again wary of one thing at all times. All of them, whether you're a specialist, whether you're a novice, whether you're a generalist, you have to have people management techniques. You've got to have the ability to communicate across the board. These are prerequisites. There's no negotiating on this. Doctors, apart from what they learn in medical school, today patients demand something else. And if the doctors and the institute realize and understand that it's the patient who's going to pay for you, if they realize that it's the patient and their attendants who are coming into the OPD or the IPD or going into your preventive healthcare checkups, these are the guys who are giving you your bread and butter. If you don't cater to them and what they require, in your limits of course, you're not going to be profitable. It's not going to happen by a long shot. And your costs are just going to go up. Then, service excellence. This is the buzzword right now. I don't know how many hospitals use it, but I think quite a few of them believe in it. They may not use the word service excellence, but service excellence it is nevertheless. In every field, whether it's clinical outcome or whether it's the service outcome, the clinical side or the hospitality side. What is the experience that the customer, the attendant, the patient goes through at the end of the day? The last that I heard, I remember somebody coming and talking to me about mobile. Nursing, they're now trying it out. I don't know if it's successful. They're trying to give, send out test papers to the nurses in some of the critical areas like needle stick injury or hand wash or something like that. They send it out on their mobile phones, they do their test and they send it back. So they don't get out of their nursing stations. Whenever they get their free time, they quickly do this 10-point questionnaire and they send it back. That way what's happening is they are able to evaluate the nursing skill at different levels at a quicker pace without pulling them out from their floor and into a classroom. Innovative, great, but again at a cost. So, what is the demand? One, the need, it's a growing industry, recognition, importance for management for performing organizations. And what do you need to enhance? Graduate degree courses, again with a lot of emphasis on people-focused training. You can cover the entire gamut in that. Then of course you have your postgraduate diplomas or certificate courses, and you have your degrees. Hospital administrator today and the management challenges, something that we've all touched upon since this morning. Pressure. How do you handle pressure? Decentralization. This is something which has come of age again. There have been hospitals which have been a single unit. Now they've come to a stage where the unit has split. So wherever the hospitals are located, they don't report in directly under a central command. Each of them operate as an individual unit with their individual so-called CEOs. So they are independent profit and loss centers. How do these guys manage? Now this has happened overnight. Suddenly board takes a decision, management takes a decision, we decentralize. And they say, we take some of the stalwarts in our institute, you become the administrator. These guys they're like hit by a bolt. What next? And then the course of trial and error starts. Not a very healthy way to do it. Not a very healthy way to do it. And this happens with some of the people who get promoted from the line, the executives in the front office, they get promoted to assistant managers, they have no clue what managing people is. They just get promoted. They're very happy, they get a star on their shoulder, they get a little promotion, they get a little hike in their fee, and the next thing they learn is, I must command, I must bark orders. That's what a manager is all about. Rubbish. That's a sure shot recipe to failure. But not their fault, because the hospital doesn't invest time in taking them through a gestation period or a pipeline which gets them oriented to becoming managers. Not their fault. Is the administrator, is the hospital. But that's a challenge again. Then, your increased market exposure. People are talking about your institute, so you've got to be more brand conscious. Manpower optimization, nightmare for every administrator. Training and development, the thing nowadays that they're talking about, but again, do you understand it to implement it? That's the question you need to ask. And then building the pipeline, that what I was talking about. So what are your target groups? The entire hospital, all those who are involved. There is no distinction between an employee and an outsourced training partner or an outsourced employee. If they are a part of your hospital giving services to your patients, they are yours. They are your responsibility. Period. Some of the trainings that we now talk about, the human part, the processes. So basically it's knowledge, process, technology, and human intervention. You can add to this list. These are some of the crucial ones that we go through. If you look at the human behavior part, unfortunately this part is not given due credit. It's not. But the crux, as per me and what I've seen across the industries I've worked in, everything starts with that one individual. And his outlook, his attitude or her attitude towards his or her people. It starts from there. If you get that right, everything else will start streamlining. Training and learning are not attained by chance. It must be sought after with ardor and attended to with due diligence. It's a continuous process. It needs dedication. It needs time. You need to invest in it. I keep using this word, invest. Some of the Government of India intervention, continuous training is essential. They say this now. I must share this with you. This was 2 years ago. Some of us, that's my team from Max Healthcare, we went to Safdarjung Hospital and we went to Ramaloya Hospital, and we trained the entire housekeeping staff over there. And the reason why, and this had come from the health ministry, they told us to go and do it, because we had developed the simplest but yes most effective way of engaging the housekeeping staff in every aspect of housekeeping, and the process that we had created was something which they were very keen on learning. So we actually went there and we trained all their housekeeping staff, which is very encouraging. You know, you're not creating that wall or that boundary between a government institute and a public institute. Healthcare is healthcare, irrespective of where you are. And like we said, if best practices can be shared openly, I mean, I think we can become a great fraternity like this, where we can demand certain things from the government as we talk about, you know, regulating prices or whatever there is to it. So, finally, once you stop learning, you start dying. Once you stop learning, you start dying. And I'll end with one small line. Sir, ladies, talent is great. Talent is wonderful. Talent is beautiful. But talent up to a point, it doesn't go any further. What takes you through and through, all the way, till the last breath of your life, is your attitude. Thank you very much.